Hello. Yes.
Hi. Well, it's not. What we're here to talk about today is a public opinion survey that we fielded. It was a collaboration between the American Dental Association and Crest and Oral-B to reach out to the American public and hear from them what they think about their oral health, how important their oral health is to them, and then what they do day in and day out to take care of their mouths. And what we learned was that Americans place a very high value on their oral health, and they think it's very important to take care of their mouths. But what we also learned is that that doesn't always translate into the right action steps as far as what they really need to do to take care of their mouths. For example, we had 30% of Americans tell us that they think that it's normal to have a little bit of bleeding when you brush your teeth. And that, in fact, is not true, and bleeding gums can be a sign of, gum disease and perhaps even worse problems. So you need to be talking to your dentist and getting advice from them about what to do to remedy that as quickly as possible.
Well, the study was really interesting because we also discovered that parents really, they want to do their best, and they really understand that they can change the course of their children's oral health. But they need a lot of guidance as to exactly how to teach their children good oral care routines. We found out that a lot of parents think that they do a better job than their own parents did of teaching their children good habits. But unfortunately, but here, unfortunately, 50% of the parents that we talk to think that they're not doing any better, and some even think that they're doing a worse job than their parents did with them. In fact, 25% think that their kids do only a fair or poor job of taking care of their teeth, and a lot don't even know when to take their children to the dentist for the first time. A lot of parents think that they needn't go before the age of 3, when in fact they really need to go before their child's first birthday. And part of the reason for that is that they need to get from their dentist specific guidelines as to just how to take care of their children's mouths so that they can teach their children good oral care routines that will, carry them through the rest of their lives and through their grandchildren's lives and so on and so on and so on. Oh, absolutely. A lot of parents unfortunately make the mistake of thinking that the primary teeth aren't that important. In fact, this morning I talked to a man who complained that his child seemed to have all kinds of problems with his primary teeth. But, I'll just wait because they're going to fall out and the permanent teeth are going to come in anyway. That's a tremendous mistake because the primary teeth actually pave the groundwork for the growth of the permanent teeth. And, you have to remember that your children learn to speak at a young age with their primary teeth. If their primary teeth aren't healthy, if their primary teeth are hurting because they're plagued with decay and other problems, it can really affect the way that your child speaks, the way that your child develops in school. In fact, one of the things that we discovered is that 1 out of 10 parents say that their children have actually missed school in the last year alone just because of preventable dental illness.
What kind of decay?
Yeah, oh, absolutely. You know,
Definitely.
one of the things that a lot of parents don't realize is that when you put your child to bed with a bottle of milk, even breast milk or juice, what you're doing is you're allowing even for a nap, what you're allowing is for the milk and for the juice to bathe your child's teeth with sugar, and the bacteria in your mouth consume that sugar and produce tremendous amounts of cavities. Cavities and dental caries is the most chronic disease of childhood. And part of the reason is that children at very young ages are suffering from rampant decay simply because their parents don't know that putting them to bed with a bottle is a bad thing. That's one of the reasons that it's important, again, for a parent to take their child to the dentist before the first birthday. These are the kinds of specific things relating to your child's oral health that you need to know as a parent to give your child a healthy oral future.
Well, I think one of the key things that we need to give to children is as they're learning to brush their teeth, they need a special kind of a toothbrush. They can't use the same kind of toothbrush that you or I would use because the head of it is too big. And so, you know, there are brushes available with different brush sizes depending on how old the child is, and your dentist can help you choose the right one for your patient or for your child.
I honestly, as a parent, I find that my children will reliably do what they see me doing. If they see me doing something that I shouldn't do, they're probably going to do it too. But, as parents, we can use that to our benefit as well. Modeling is really important in teaching your kids good oral care. If your children see you going to the dentist on a regular basis, if your children see you brushing twice a day, if your children see you flossing, and eating a well-balanced diet, they're a lot more likely to do the same for themselves and for their children and so on. Yeah?
That's correct.
Right. A lot of great information is there, including age-by-age guidelines as to how parents can help keep their children's mouths healthy, and their own mouths as well.
It certainly does. Both Crest.com and Oral-B.com contain information for consumers on how to take care of their mouths, on how to take care of children's teeth. We place a very high value on educating the public about the importance of preventive dental care. Thank you.
Thank you.